Imagine walking into a doctor's office seeking help for something personal and painful, only to leave feeling judged. For many women, this is the reality of routine gynecological visit. This is not an isolated experience, it's happening across the globe, from the UK to India, where women face judgment, shaming, and delays in care due to stigma surrounding their sexual health. In the UK, many women wait years to receive a proper diagnosis for conditions like endometriosis. In fact, studies show it takes an average of 7 years for women to get the right diagnosis. But why? Because many women are simply dismissed or told that their symptoms are just part of being a female. Similarly, in India, unmarried women often face a different kind of stigma. When seeking reproductive health care, they are turned away by doctors who refuse to treat them, assuming their sexual activity is inappropriate. Naga Manchetti, BBC presenter, shared her story of being told to suck it up by doctors as she struggled with painful symptoms of adenomyosis. Women like her continue to face a system that overlooks their pain and needs. In India, campaigns like Health Over Stigma are working to change the narrative. Women's rights activists and organizations have rallied to push for inclusive care that doesn't judge based on marital status. But despite these efforts, stigma persists and women continue to suffer in silence. In 2022, a 25-year-old unmarried woman in Chennai, India was shamed by her gynecologist during a consultation for endometriosis. The doctor remarked that her vaginal canal was not like unmarried girls should be, implying judgment about her sexual activity. The incident reflects how misogyny and moral policing still persist in Indian healthcare settings. Though the forms of judgment may differ, the experience is the same. Women are left feeling ashamed, unheard, and alone. In the UK, a woman's sexual health is often dismissed as a personal choice or inconvenience. In India, it is considered a taboo tied to her social identity. However, it doesn't have to be this way. Change begins with education, respect, and the understanding that every woman deserves to be treated with dignity, regardless of her sexual history. If we continue to speak out, to share these stories, and demand better care, we can help break down the stigma for women in the UK, India, and everywhere else. Join the fight for non judgmental care because no woman should feel ashamed to ask for help. Judgment has no place in healthcare, whether in India or the UK. Women deserve care rooted in respect, not shame. We need to fund research that prioritizes women's health, from endometriosis to PMDD conditions too long ignored or dismissed. We need doctors who listen, not moralize, and we need to speak up for those who have been silenced.